Talk about some sinus rhythms.
Okay.
What does a sinus rhythm mean?
Start with the SA.
All right, it originates in the SA node where God intended it. Yes? Okay. So in order to say that something is a normal sinus rhythm, what has to be true?
The PRI has to be within normal range.
All right, so PRI has to be, what's normal range?
0.
Well, let's start at the top. What's the first thing you check?
Heart rate.
The heart rate. Okay, so the heart rate has to be between 60 to 100. What's next?
To see if it's in regular or irregular.
Is it regular or irregular? What's next?
Then you check the PR.
Hmm?
Is there a P?
Is there a P wave? And does it look normal?
Then you check the PRI.
Yes, you can check the PRI. And what should that be?
0.12.
0.12 to 0.20. So you also said is a heart rate 60 to 100. Is it regular? Is there a P wave? Is the PRI 0.12 to 0.2? Is the QRS less than 0.12? Does every P
Come with a
come with QRS? Okay, and are the P waves normal? Y'all said that. If all those things are true, that is a normal sinus rhythm. Yes?
Yes.
Okay, don't look at your paper. Turn them over for a second. Okay, so in a normal sinus rhythm, heart rate has to be 60 to 100. The PRI has to be 0.12 to 0.20. The QRS has to be less than 0.12. Good. Is this patient stable?
Yes.
Yes. Okay, that's where everybody should be living. Yeah. And there's nothing you need to do for it. Yes.
Yes.
Let's go to sinus Brady. What's your worst case scenario of sinus Brady?
Poor perfusion.
Signs of poor perfusion. The patient's going to start pulling away from extremities and pull into here.
Central.
So the first thing you do when a patient's heart rate is less than 60 is check for signs of poor perfusion, such as
Cap refill.
where does it go? Cap refill
No.
would be.
Good.
How would you document that?
Less than like 2 or like
Greater than. You do this every time. So I'm going to ask you every time. So an increase. That's why I pointed you out. Increase cap refill. That would be more than 3 seconds, right?
Yes.
The extremities are going to feel cold. They may be
Pale.
or mottled, right? Yeah, those are signs of poor perfusion. That's like, oh no. Okay, but some people live in sinus Brady. Like, what kind of people live that way?
Athletes.
How come? Why is their heart rate normally just low and they are perfusing beautifully?
Because they just adapted to, I don't know, doesn't tell me that our heart.
Okay, so why do patients with sinus Brady have signs of poor perfusion? What led to that?
Because they're not getting enough blood.
Okay, so what is going to be low when we actually calculate it? Like
Cardiac output.
their cardiac output is low, right? And how do you calculate cardiac output?
Heart rate.
Stroke volume times heart rate, right? So the heart rate is low. Okay, what is a stroke volume?
How much is being pumped?
The amount that's being put out of the heart per beat or per pump, right? What determines your stroke volume?
Preload, afterload, contractility.
Contractility is the big one. And how do I ask this? What part of your heart is responsible for contractility?
Ventricles?
No. What part of your heart is responsible for contractility?
The
Muscle, right? So when you have an athlete that works out all the time, how is their myocardium looking?
Strong.
Very strong. So that means their stroke volume is going to be very high, which means their heart rate can slow down and it's no big deal. Do we understand?
Yes.
Okay. So that's why athletes can be low and it's not a big deal. Got me?
Mhm.
Okay. So in sinus Brady, where is the electrical impulse originating from? The SA node, right? What is their heart rate? Less than 60. What is their PRI? I'm going to keep asking you over and over again. 0.12 to 0.20. We're really slow with it, but we'll get it by the end. I know I have to think about it too. What's their QRS?
Less than
0.12. Are they stable?
Yes.
I don't know until
You check.
I check for signs of poor perfusion. So if you check and their pulses are good and their extremities are warm, are they stable?
Yes.
Yes. Do we do anything?
No.
No, because they're happy and stable, right?
Yes.
So if their heart rate is like 42, I check this patient, everything looks good. Are we going to medicate them with something?
No.
No, because
They're fine.
they're fine. Okay. If I check the patient, their heart rate is 50 and they have signs of poor perfusion. What are you going to do?
Aspirin.
Oh, okay. So we're going to give some atropine because atropine does what? Increases heart rate. Give me some causes of sinus Brady. What would cause you to have a sinus Brady? Other than athletic, you all already said that.
Depressants.
That causes respiratory.
Like end stages.
Okay, maybe end stage shock. Maybe nothing simple. These are simple conditions that I've taught you. Like, what's a condition where everything slows down? Hypothyroidism is a big one where we see sinus Brady. Yeah. What about body temperature? Hypothermia, because everything's going to slow down. Lots of different heart diseases can cause bradycardia over time as well. Yes.
Yes.
Okay. When we talked about neuro, we talked about a bradycardia condition. It was bad, by the way, a bad condition.
Oh, it's dyslexia. That one. No, it's like autonomic something. Spinal cord thing. It's the emergency one.
It has nothing to do with the spinal cord. So, I mean, okay. Are you, no.
Cushing's triad.
Yes, it is part of Cushing's triad, which means patient has increased ICP. So an increased ICP, you may also see bradycardia.
Yep.
Okay. Cool. Okay. What is your priority when you see someone in sinus Brady?
Check for pulses.
Check for signs of poor perfusion. Okay. If there is no poor perfusion,
Atropine.
if there's no poor perfusion,
CPR.
if there is no poor perfusion,
No poor perfusion.
we just, okay. If they're just normal, then we just live. Okay. If they are symptomatic, then the first thing we would do actually would be,
check for pulses.
okay, no, CPR first, because you don't have atropine just standing there, do you?
No.
Okay, so we're going to start CPR. That's a CPR protocol, right? That's an AHA
Yes.
protocols. If the heart rate's less than 60 with signs of poor perfusion, we go ahead and start compressions,
Yeah.
right? Okay, but if the patient's like, hey, how's it going? Is there oatmeal for breakfast? I probably wouldn't start, you know what I mean? So that's why we check for signs of poor perfusion first. Okay, so we are going to start CPR if the patient's symptomatic. We can give atropine. What other drug could we give that makes the heart rate? And we could also give epinephrine. Yeah.
Yeah.
If this is a contractility problem that is causing the sinus Brady, then our options would be positive
Dopamine.
inotropes like dopamine or
Dobutamine.
dobutamine. Got it?
Yeah.
Okay, just so you know, I'm adding this in. Atropine is 0.5 milligrams per dose. Y'all will need to know that for exams. Huh? Yeah, just do it. I like how it gives you a cap on atropine, like, oh, we've done too much. And the patient's like, beep, you know, I mean, what do you just push it in? Anyhow, all right, do we understand sinus Brady?
Yeah.
All right, let's do sinus tachy. What are the causes of sinus tachycardia?
Caffeine.
Caffeine, tobacco,
Lung disease.
sometimes lung disease, huh?
Anxiety.
Anxiety,
Dehydration.
dehydration.
Cushing's reflex.
Cushing, oh, okay. Oh my God, Cushing's reflex. Fever,
Shock.
the beginnings of shock, maybe. Yeah. Hyperthyroid. Good job. Y'all are getting this. All right. So causes are usually treatable. Yeah. Okay. So in sinus tachycardia, heart rate is greater than 100. PRI 0.12 to 0.20. We're still okay. QRS complex is less than 0.12. Are they stable?
I don't know. Are they?
But probably. I mean, these conditions you guys told me they're
Yeah.
probably.
Okay.
However, sinus tachy can end up going into VTAC. So it is something we have to watch for, obviously, and or SVT. It could do SVT too, right?
Yes.
So the first thing you're going to do for sinus tachy, though, because here's the thing with sinus tachy. We know cardiac output is stroke volume times heart rate. Y'all told me that. What happens when the heart rate goes really high? Like, let's say their heart rate is 180. The stroke volume is going to go down. So I still need to make sure they're perfusing, right? So the first thing I would do is sinus tach is check for signs of poor perfusion. Okay, if there aren't any, then what are you going to do next? I'm sorry, let me ask it differently. Okay, if they have, like, they're perfusing beautifully, what's your next step?
Oh,
But you have to do something. Find the underlying cause and treat it. What are some common things we do for sinus tach, though? Like, how do we treat a high heart rate? Like, real easily. Wait, real easily. Because no matter what these things are, fever, anxiety, like any of these things, you know, how do you lower someone's heart rate real, like, easily and quick?
Sit down. Couple breaths.
Okay.
Fluids.
Yes, we're going to give them fluids because most of the time it's because the blood pressure is a little on the low side. So they're going to get a little tacky. I mean, if they have fever, are we going to give them fluids? Yeah. If they have hyperthyroid, are we going to give them fluids? If they have anxiety, we probably still will. Yes. Any of these things. Yeah. Like infection can cause a higher heart rate, right?
Yeah.
So fluids is an easy way to just kind of like chill out the heart and be like, your blood pressure, good. Yeah.
Yeah.
Okay. All right. Then our other options, if this is not a fluid problem, we've given them fluids, everything's fine. Then how do we lower the heart rate? We'll give beta blockers at that point, right? Because beta blockers work better on heart rate. How are we going to set up their environment?
Low
Low stimulation. You're going to work them do deep breathing and relaxation, maybe some guided imagery. Yeah, you want to do some biofeedback. If it's a fever issue, then we can give them fluids, yes, and antipyretics, yes. If this is an anxiety issue, fluids and probably some anti-anxiety. If this is a pain issue, fluids and then some opioids, right? So we need to find the underlying cause. Easy enough?
Yeah.
All right, do we understand sinus rhythms?
Yeah.
Okay. No, you don't need to turn it over. No, you do not. All right.
I have to go to the get out of order.
Oh, okay.
That's why that sim made me so mad because she literally was in bradycardia